Hello and welcome, my friends. This is DR.SAPTARSHI. You have heard me speak about lots of homeopathic remedies, comparative metromedica in the past. But today what I'm going to share with you is what holds most importance in homeopathic practice, the dispensing of homeopathic remedies. Whenever we talk about dispensing, all over the globe there are different ways how homeopathic medicines are dispensed. But the most correct way is what Hahnemann has mentioned 200 years back. So you may be a homeopath who is listening to my videos, you may be a pharmacist, you may be a lover of homeopathy who enjoys listening to homeopathic lectures. And in all the three cases, you must be completely aware of how we must dispense our homeopathic remedies to increase your success manifold while taking the homeopathic remedies. Without any further ado, I'd like to share with you some of the important sections from the Organon of Medicine. If you have the Organon of Medicine, 5th and 6th edition combined, translated by R.D. Dudgeon, that is the best book to have with you, because if you consider the 6th edition, that's just with the LM potencies, but the 5th and 6th, you'll get a complete overview of the centesimal scale as well as the LM potencies. And please do listen to this very important piece of information. If you have the Organon, I'd like to share with you a few of the important sections from the Organon of Medicine and how we can implement that in our practice. First and foremost, I'd like to share with you, and I will mention the sections as well. Section 286, aphorism 286. And this is very important to understand why we give importance to water dispensing. I have always, especially my students across the globe will understand and know that we give a lot of importance to water dispensing. You must dispense the homeopathic medicines in water. I'm reading this section. For the same reason, the effect of homeopathic dose of medicine increases the greater the quantity of fluid in which it is dissolved when administered to the patient, although the actual amount of medicine it contains remains the same. So whenever you are prescribing any homeopathic remedy, you must dispense it in water. A dry dose or a dose directly given on the tongue will never give such a response as the medicine in water. Why? For in this case, we have, when the medicine is taken, it comes in contact with a much larger surface of sensitive nerves responsive to the medicinal action. So section 286 gives the apt description of why you should dispense in water. You see the line, the effect of homeopathic dose of medicine increases the greater the quantity of fluid in which it is dissolved. So you always make sure to give the medicine in water in an acute or in a chronic case, even when you are prescribing centesimal potencies. I'm talking about 5th edition here, so you must dispense it in water. This is one of the very important sections to highlight that, section 286. I will further demonstrate to you how we are prescribing the remedies, how we are dispensing in a practical way as well. Now, one of the very important factors, my friends, is also you must understand the size of the globules. Across the globe, people use globules of different sizes, but again, one of the very important factors to understand is the size of the globules. I'm going to share with you another very important section which mentions about the size of the globule is the footnote of section 285. For this purpose, it is most convenient to employ fine sugar globules of the size of poppy seeds. So whenever you are giving globules, it should be of the size of poppy seeds. So that poppy seed globule is very, very important. One of which, imbibed with the medicine and put into the dispensing vehicle, constitutes a medicinal dose. So Hahnemann exactly mentions one globule and you're putting it in the dispensing vehicle. What is the dispensing vehicle? The dispensing vehicle is water. And when you're giving this constitutes a medicinal dose. People have different concepts of what is a dose, what is a homeopathic dose, and you do not have further to look to. Organon mentions it in details. So one globule, what is the size of the globule? Poppy seed. You put it in the dispensing vehicle and that will constitute for you a medicinal dose, which is very, very important to understand. Another very important factor when we are considering the dispensing is the dispensing in with sugar of milk. Section 272. This is mentioning about dispense with sugar of milk. So if you consider section 272, 6th edition, I'm reading that again. Such a globule placed dry upon the tongue is one of the smallest doses for a moderate recent case of illness. So whenever you're placing that globule dry on the tongue is one of the smallest doses. Here but few nerves are touched by the medicine. So why you're giving in water? So that more amount of nerves, more quantity of nerves comes in contact with the medicine to produce a better reaction, to produce a favorable reaction for cure. A similar globule crushed with some sugar of milk and dissolved in a good deal of water and stirred well before every administration will produce a far more powerful dose. So when you are giving the globule plus crushed with sugar of milk and then you are giving it in water, and that will consider a far more powerful effect. Section 272, 6th edition. When you're giving it dry on the tongue, it's always a very moderate quantity of dose. But whenever you are giving it in sugar of milk, dissolved in water, and you are giving it to the patient, it will produce a far more powerful effect, which is very important for homeopathic prescribing. So my friends, you have to understand here, the dosage is very important. So many of us prescribe the correct remedy, but sometimes we make mistakes when we are dispensing the medicine. We give a too strong dose or we give a too minute dose by giving just dry on the tongue. So my earnest request to all my friends who are seeing me today, that make sure you're dispensing the medicines in water, even in acute, even in a chronic case. Another very important factor to highlight this, section 275, which Hahnemann mentions. The suitableness of a medicine selected for any given case of disease does not depend on its accurate selection alone. So whenever you're prescribing a remedy, it doesn't only depend on its homeopathic selection, but likewise on the proper size or rather smallness of the dose. Whenever you're giving the remedy, you may have selected a correct remedy, but you must give it in the correct form. So you see, it depends on the proper size or rather smallness of the dose. How will you give it the minimum dose so that no aggravation is produced? More you dilute the remedy, there are less chances of any aggravation. A. B. There are more chances of favorable action because it comes in contact with more nerves. So section 275 is also very important in that aspect as well. Again, one of the common problems plaguing today's homeopathic community, especially the homeopathic world, is people give drops of doses. I'll give you two examples here. I have two files here. One is of a Bryonia 30, which is in dilute form, which is a dilution, which is a liquid of form of Bryonia 30. And I have globules here, which is the poppy seed globules of Bryonia 30. You'll find homeopaths across the globe, you'll find pharmacies across the globe prescribing this one, the drop doses, which is absolutely not correct. This will always produce a violent reaction. But whenever you're giving the homeopathic remedies in globules, in the poppy seed globules, I'm always saying that, there is always a far less chances of aggravation, A, B, far more powerful effect. I will vouch for this again in different sections. Section 246, footnote. Section 246, footnote. And the very important part here, my friends. Again, I'll read that. And this is also very important. I'm reading from the footnote in section 246, fourth paragraph of a long footnote. One single dose should be given. And for instance, in place of giving a single, very minute globule, so you have to give what? A single, very minute globule of the size of poppy seeds, moistened with the medicine. So you must moisten the globules with the medicine. In the highest dynamization, in the potentization, it is wrong to administer even 6, 7 or 8 of them at once. So those of you who are giving 6, 7, 8 globules together, also that is wrong. Or even half or a whole drop. So if you're giving half or even a whole drop, that is also not correct. Result was almost always less favorable. When you're giving this, the result is almost always less favorable than it should have been. It was always actually unfavorable. often even very bad, an injury that in a patient so treated it is difficult to repair. So whenever you're giving these in either A, you're giving 6, 7 or 8 globules, that's absolutely can produce an unfavorable effect. Or you're giving few drop doses. You see, 1 or even half of a drop, Hahnemann mentions that. That is also unfavorable. So use poppy seed globules, but use it in a minimum dose. Use it in a single, or at least Hahnemann has mentioned in different places, maximum 2 globules, not more than that, whenever you're giving the medicinal dose to the patient. So section 246, the footnote, the 4th paragraph, and again, this is none of my ideologies or none of my theories. I'm sharing with you what the founder of homeopathy has mentioned regarding the dispensing of medicines about 200 years back. But unfortunately, we are faltering. We have developed a different methods. We have developed a different systems, and we forget what we should look back to. Another very important section, my friends, section 285 and section 285 footnote. As I mentioned, it's always useful to give the globules to the patient, and I have shared with you in 246 and different other sections where a drop or even half of a drop is harmful, is unfavorable to the patient. And here you see in section 285 footnote, for this purpose it is important to employ fine sugar globules of the size of poppy seed, one of which imbibed with the medicine and put in the dispensing vehicle constitutes a medicinal dose, which contains about 300 part of a drop. For 300 such globules will be adequately moistened by 1 drop of alcohol. You see, Hahnemann mentions here that 300 globules can be moistened, can be medicated with 1 drop. So whenever you're prescribing 1 drop of the remedy, you're always giving a large dose. You're giving 300 globules, which may produce a violent aggravation. So 2 points, my friends, I like to take back to you, especially if you are a common man listening into homeopathy. A, please make sure you're dispensing or you are taking the medicine in water. You have to dilute the medicine in water when you're taking it. A. B, make sure whenever you're taking the remedies, it must be in fine sugar globules of the cider poppy seeds. Do not take drops of medicines, which is always harmful for your treatment. For my homeopathic friends who are listening in, you may have the certain misconception that it's only in 6th edition, in L. Potencies, Hahnemann has advised for dispensing in water. I've shared with you numerous sections. I shared with 286, where Hahnemann mentions you must dispense in water even in centesimal scale. Another very interesting section where Hahnemann mentions that is section 128, especially with relation to drug proving. So section 128 in correlation with drug proving. Last few lines. We adopt to give to the experimenter an empty stomach. So giving to the experimenter an empty stomach daily from 4 to 6 very small globules of the 30th potentized dilution of such a substance moistened with a little water. So even when you are doing drug proving, here he mentions 4 to 6 globules, especially for drug proving. But during treatment, I have mentioned to you, he mentions about maximum 2 globules. So when you are dispensing it in, even in the centesimal scale, he mentions to moisten it with a little water. So even in the 30th potency, if you have a misconception that only LM potencies are dispensed in water, my friend, you're absolutely and completely wrong. Even with the 30th potency, you must dispense it in water. So again, this is very, very important to understand for practice. Now what or how we go ahead with a method of prescribing or method of dispensing. Again, as I shared, this is the fine sugar globules, size of poppy seed. We have small paper capsules, or what we call as sachets, that is filled with sugar of milk. I'm opening one of it. That is filled with sugar of milk. This is non-medicated sugar of milk. And when we are prescribing the remedy, maximum 1 to 2 globules, you're putting it in the sugar of milk and you're giving that to the patient. So I repeat again, 1 sugar globule or 2 of the size of poppy seed, the medicated medicine. You put it in this paper capsules or sachets which contains sugar of milk. So 1 globule of this medicine, put it in the paper capsule of sugar of milk sachets, and then you wrap it up, and then you give these to the patient And we always ask the patient that put this medicated sachet, medicated paper capsule into the water and dispense and drink that water gradually over a period of, if in an acute case, it may be a day, it may be 2 days, it may be 3 days, but gradually drink it in water. You're diluting it and you're asking the patient to drink in water for a period of 3 to 5 days even, in many cases, in chronic cases. Why I'm saying so? What are my points, my reasons of mentioning this to you? I shared with you section 286, dispense it in water. I shared with you section 272, where Hahnemann mentions the globule is crushed with some sugar of milk and dispense it in water. I'll share with you a few important parts from the chronic disease. This is, I'm referring to Hahnemann's chronic disease. The name of the part is medicines. There is a chapter called medicines in chronic disease, and this is again very important to share with you how we are prescribing the remedies. Fourth last paragraph is from the section of medicines. To prepare the pellets to give to the patient, one or a couple of little pellets are put into the open end of a paper capsule. I shared with you the open end of a paper capsule containing powdered sugar of milk. This contains powdered sugar of milk. I shared with you. This is then stroked with a spatula or the nail of a thumb. You can stroke it with a spatula or nail of a thumb with some degree of pressure until it is felt that the pellets are crushed. Then the pellets will easily dissolve in water. And then when you're giving it to the patient, you ask them to dissolve it in water and take it. Now again, there are many misconceptions. Pellet means big size globules. Next paragraph. Whenever I mention pellets in giving the medicine, I always mean the finest of the size of poppy seeds. So whenever I mean pellets, Hahnemann says it means the finest of the size of the poppy seeds, which is globule number 10, which is very important. Now whenever you are giving this in water to the patient, whenever you're dispensing the medicines in water to the patient, Hahnemann again reiterates that it's always best if the patient drinks it gradually over a period of days. Especially, he mentions about divided dose. I'd like you to again share with you another very important section from the chronic disease. And this is the preface to the 5th volume. I repeat. Preface to the 5th volume. If, however, every potency is dynamized with the same number of successive strokes, we obtain even in the 58 medicines of most penetrating efficacy. So any potency, we obtain penetrating efficacy. Medicines so that every minute pellet moistened with it, so whenever giving the remedy moistened with the medicine, after being dissolved in a quantity of water, you're dissolving it in a quantity of water, must be taken in small parts if we do not wish to produce too violent an action on sensitive patients. So if you do not wish to produce a violent action on sensitive patients, you must dissolve it in water and give it in small parts. So whenever you're giving the globules, you're minimizing the chances of aggravation. A. B. You're producing a far more favorable effect than giving a drop dose of medicine. Secondly, whenever you're dispensing it in water, larger number of nerves will come in contact with the medicine. And when you're giving it in small parts, so you give 1/3 of this, 1/3 of this, and the last third over a period of time, first day, second day, and third day, and you're giving it in small parts, the patient is still taking 1 dose of the medicine, but since you're dividing it into small parts, the chances of aggravation in case of sensitive patients is minimized. My father has always taught me, he always gives me an example of a pizza. Whenever you divide a pizza into 3 parts or 4 parts, and you're taking the 1 pizza in the morning, you're not taking 1 pizza in the afternoon, where you're taking 1 pizza in the evening. At the end of the day, you have still taken 1 pizza, but you're divided into 3 parts. You haven't taken 3 doses or 3 pizzas. Similarly, for skeptics of homeopathy or skeptics who are homeopaths who feel when you're dispensing in water, you're taking too many doses according to the SIPs, you're absolutely wrong, my friends. Because whenever you're giving the remedy, you're giving still 1 single globule. But think of the example of the pizza. Like you divide the pizza into 3 parts and taking it throughout the day. but at the end of the day you're still taking one piece. Similarly, you're just taking one dose of the remedy, but as you're dispensing it in water, as you have medicated the remedy and you're taking it in water in small parts, in divided doses, the action of the medicine always increases manifold in those cases. So you must remember these factors while prescribing the remedy. Few other factors which I'd like to share with you, again to reiterate my importance of these sections. This is, I'm sharing with you from Boning Hussein's lesser writing. Boning Hussein, famous homeopath, and this is Boning Hussein's lesser writings. The name of the chapter is Hahnemann's Doses of Medicines. Hahnemann's Doses of Medicine. And there he mentioned about his quoting Hahnemann. He was fully convinced it was not necessary in any case or under any circumstances to give drop doses of the medicine. So those of you who give 4 drops of Bryania 30, my friend, you are giving absolutely in a very wrong way, which may produce a violent aggravation. He saw injury of giving larger doses. So never ever prescribe drop doses of the medicine. It will always produce harm rather than good. Again, Boning Hussein quotes Hahnemann. Hahnemann at all times used well-known small pellets, and I've shared with you in the chronic disease, by pellets he means fine sugar globules of the size of poppy seed. Moistened with the dilution, dissolve 1 or 2 in water and shake it up. Obviously, in very sensitive patients, you must understand, even if you want to minimize the dose even further, you put 1 globule of this or 2 globule of this in the water. Generally what we do, we ask the patient to drink this medicated water over a period of 3 days or 5 days. 1/3, 1/3, 1/3. Again, you're giving it in small parts to minimizes the chance of aggravation. But you also have to understand, if it's a very sensitive patient, you can take 1 spoonful of this, put into a second bottle. Again 1 spoonful of that, put in third bottle. So it depends. If patient is highly sensitive, you can use the second bottle or third bottle in very sensitive patients as well. But in most of the cases, as I mentioned, we put 1 globule in this paper capsules, crushed with the sugar of milk, and then we give this to the patient. They take this, we put this in the envelope, and we give this to the patient, and they take it home and they dissolve it in water and drink it for a period of 3 days. I've shared with you different sections highlighting these factors to make you understand that this is the best and this is the only way of prescribing the remedies. Another part which I'd like to share with you before we end, a few other homeopaths who have always mentioned about dilution. This is from Art of Interrogation by Dr. Pierre Schmidt. Dr. Jar asserts that the administration of the remedy in watery solution does not constitute a repetition of the dose. So whenever you're giving 1 single globule in water, you're always giving 1 single dose. So this is very, very important to understand while prescribing the remedies. And lastly, I'd like to share with you another important section before we finish up. One of the very commonly asked questions is about expiry of homeopathic medicines. Do homeopathic medicines have an expiry? My answer to that is again from the Organon, section 288, footnote. And he mentions here, a globule of which impregnated with the medicine retains for this purpose all its power undiminished for at least 18 or 20 years. My experience extends this length of time. So Hahnemann says a medicine, if it has been medicated, it will have its action for about 18 to 20 years. And so there is no question of expiry of homeopathic medicines. The globules can retain its power if it has been medicated for this length of time. Hahnemann says it may be more. My experience extends this length of time. So again, to summarize, please, my friends, I want you to know 2 things. A, use globules. Use globules of the size of poppy seeds, not drops. Section 246, Hahnemann mentioned a drop or even half a drop is harmful. Forget 3 to 4. Whenever using the globules, one globule, you put this in this paper capsule. I shared with you sections from the chronic disease. You put this in paper capsule, this contains fine sugar of milk. You put 1 or 2 globules in this. Then you close it and you give this to the patient. You dispense it with the patient. And I'm sharing with you what we practically do. We put this in the envelope and give this to the patient. Ask the patient to drink it in water. You put this sachet containing the globule in water and you give it in small parts. Again, my reference from the chronic disease. So that is to minimize the aggravation, so as to increase the favorable effect. Small parts, first day, 1/3, second day, 1/3, third day, the last third. And you can even give it for 5 days to 7 days in very chronic cases to minimize the chances of aggravation. In very sensitive patients, you may take 1 spoonful, put in a second bottle, another 1 spoonful in the third bottle. You can do that for very sensitive patients. Hahnemann mentions that. So make sure you follow these practical ideas from the Organon of medicine. And we do that in practice, and believe me, the result is always manifold. As I shared with you section 275, the success does not depend on the accurate selection alone, but on the rather size or the smallness of the dose, which is important for prescribing. So please go ahead, implement these practices in your own practice. Thank you very much. Long live Hahnemann, long live homeopathy.